Hello everybody, this is Dr. J from LifeSpine Health Enhancement Center. There was a study that was produced in 2013 and it was published within the Journal of Manipulative and Physiological Therapeutics. Whew, that was a long title, but the benefits or the results of this study showed the benefits of chiropractic adjustments for the sufferers of low back pain compared to a few different control groups. And the wonderful thing about this study is that they were able to demonstrate objective physical evidence appearing on MRI studies that backed up why it is chiropractic adjustments provide such a wonderful benefit for sufferers of low back pain. Now, they theorized that gapping of the zygaphosphyseal joints in the lumbar spine was the mechanism that triggered the reduction in pain for chronic back pain sufferers. Now, before you blank out and turn the video off, let me explain to you what that means, because it is very simple once you know the vocabulary. So when we're talking about the lumbar spine, we're referring to the 5 bones located in the low back. And on my model behind me, that's located right within this region, between this area here. Now, to get a close-up of the zygaphosphyseal joints, I'm going to borrow my model bones. So imagine that I'm just going to pluck 2 bones out of the low back and bring them up into a closer view. So here you're looking at the back side of one spine, at 2 different bones in the back. And the zygaphosphyseal joints, also called the Z joints or the facet joints, are these joints right there. They provide the connection between every single bone in the spine. And you have a pair on the top of the bone and you have a pair on the bottom of the bone. So these bones are responsible for holding the bones in place in limiting and controlling the proper range of motion within the bones. But when these joints get locked up and they do not move, one, it can provide pain. And there's a lot of theories as to why this happens. But the old adage says that if you don't move it, you lose it. And that's very true. But motion is a natural painkiller. That's why exercise alone is such a wonderful thing for our bodies, because it gets our joints moving. And when our joints are moving, there's a thing called mechanoreception. Mechanical movement, just the fact that I'm moving a joint, is going to send a message to my brain through the nervous system that pretty much says, everything's okay here, everything's working as it should, no need to be alarmed. However, when these joints are not moving due to injury or scar tissue or muscle spasms, whatever the case may be, there's almost like a light switch that goes off at this particular level in the spine. And then a message is sent up to the brain that says, hold on, things are not moving the way that they should here, something's not right. And that's expressed as pain. And so pain is a way that your body kind of identifies an area of injury to the body and wants you to do something about it. So what you do is that you unlock that joint, you restore its normal motion so that pain signal turns off and the body goes back to functioning the way that it should. However, the results of this study were amazing, because they found that after a chiropractic adjustment, they performed an MRI study. And an MRI study is a gold standard for looking at soft tissues in the spine, particularly joint capsules, muscles, discs, etc. But you can look at the body in many fine slices, and so you can get extreme detail at very small structures, such as the Z joints or the facet joints. And so they looked at the facet joints and they measured how wide the separation was after a chiropractic adjustment, how much range of motion was gained by unlocking the joints with the chiropractic adjustment compared to other treatments. And they found that chiropractic adjustments in combination with side posture positioning was the best result in producing a range of motion that was able to lower pain scales in sufferers of chronic back pain. So this is a wonderful study that supports why patients of chronic low back pain who choose chiropractic care are not just receiving a fast and effective form of pain relief, but how it's affecting the spine and position of the body. And if it's done correctly, you can also gain very good long-term results. Now, here at LifeSpine Health Enhancement Center, we serve the greater St. Louis Metro East area, and we focus on corrective spinal care. And not to go into too much detail, but your posture can be measured and evaluated objectively with use of things such as x-rays. And based upon how your body is aligned, we can dictate how far off of normal or ideal you are. And you can also predict, based upon those measurements, if you are more likely to be a sufferer of chronic low back pain, or if the posture that your body is in is going to protect you from developing these chronic pain syndromes. So it's evidence-based approach to a patient-centered form of care. And for many people in our area, it's got them the results that they've been desperately searching for many, many years. So if you are a sufferer of low back pain, or you have a friend or family member who you care about who has been battling with finding a solution to their chronic pain syndromes, please encourage them to seek out chiropractic care as a valuable resource tool to not just get them pain relief, but also provide a lasting solution to their problem. And please, if you're in the St. Louis Metro East area, consider LifeSpine Health Enhancement Center as a resource for you to use. If you like what you hear on this video, please subscribe to this channel and you'll get regularly updated alerts as to when we post new information. Also visit our website at www.lifespinecenter.com. Click share, click comment, share this with your friends and family, and let us know how we're doing. Once again, this is Dr. J from LifeSpine Health Enhancement Center.